Hello guys, this is Indian Medico and in this video we are going to discuss about SMILE, that is Small Incision Lenticule Extraction. SMILE is a femtosecond laser refractive surgery. It is a relatively new technique. It is entirely based on femtosecond laser, so no excimer laser is needed. The procedure of SMILE involves removal of a lenticule of tissue from corneal stroma. It is the newest laser refractive procedure and is gaining popularity in use. Coming to the method of SMILE, an intrastomal lenticule is created using femtosecond laser as you can see in this picture. A small surface channel of 2 to 3 mm is then created using femtosecond laser which is continuous with lenticule incision. The lenticule of tissue is then removed via the surface channel through surgical instrumentation. As you can see in this picture, there is no flap in SMILE. Coming to the indications of SMILE, it can be done for myopia from -1 diopters to -10 diopters. It can be done in astigmatism up to 5 diopters. SMILE is not used for hypermetropia yet. Coming to the advantages of SMILE, it is less painful than surface ablations. It has rapid visual rehabilitation with similar effects to LASIK. It causes possibly less dry eye and quicker recovery from dry eye. It has potential biomechanical advantages allowing treatment of thinner corneas compared to LASIK. Coming to the disadvantages of SMILE, there can be lenticule related complications which are uncommon. As discussed earlier, SMILE is unsuitable for hypermetropia. Also, SMILE is a relatively new procedure, so long-term results are not yet available. If you have any suggestions, please let me know in the comments section. For more such videos, please check out my playlists. Thank you.